Aloha and welcome back. In this segment, we are going to discuss how diabetes affects heart health. Heart disease is one of the most common complications of diabetes. The two often go hand in hand. The reality is having diabetes can double your risks of having a heart attack or a stroke. In fact, diabetic patients without a history of coronary heart disease may have the same risk of heart attack as non-diabetic individuals with confirmed heart disease. Here are the ABCs of a healthy heart. Those are the things you want to pay attention to and get under control. A stands for your A1C or your hemoglobin, and as we have mentioned before in other segments, this is the number that represents your average blood sugar over the last 3 months. A normal A1C level is below 5.7%. A level of 5.7 to 6.4% indicates prediabetes, and a level of 6.5% or more indicates diabetes. The recommendation here is to manage it to 7% or less. This is the recommendation for a person already diagnosed with diabetes. B is for your blood pressure. 120/80 or lower is considered optimal, but make sure it isn't lower than 90/60, which is considered pretty low. C stands for cholesterol. It is important to know your numbers. Our body produces cholesterol, so we don't actually have the need to obtain it from food. Excess saturated fat in our diet could also contribute to higher cholesterol levels. Smoking can also elevate the LDL or bad cholesterol in your blood and decrease the HDL or healthy cholesterol. Total cholesterol should be less than 200. LDL or the bad cholesterol should be less than 130. HDL or the good cholesterol should be greater than 60. High cholesterol levels in your blood can lead to buildup of plaque in your arteries, causing them to become narrower. This increases the risk for heart disease, heart attack, and a stroke. In this category, we also include triglycerides, which should be less than 150. Triglycerides are fats from the food we eat that are carried in the blood. Most of the fats we eat are in triglyceride form. Extra calories, alcohol, and sugar in the body turn into triglycerides and are stored in fat cells throughout the body. Triglycerides are lipids or waxy fats that give our body energy. Your body makes triglycerides and also gets it from the food you eat. High triglycerides combined with high cholesterol raise your risk of heart attack, stroke, and pancreatitis. Now let's look at a few tips to help you keep your heart healthy. Limit foods high in unhealthy fats and replace them with heart-healthy fats such as nuts, seeds, and avocado. Keep in mind that even though these fats are healthier, they are still highly caloric, so limit the amount if you are trying to lose weight. Choose lean meats, and when given the choice, select plant-based protein. They are much lower in fats and contain more nutrients. Be mindful when using the salt shaker, and keep in mind that much of the food you purchase in packages or cans contains high amounts of sodium. Limit sodium intake to 2,300 milligrams or less per day. This is approximately the amount of salt that would fit into a teaspoon. Try not to add salt to meals or while cooking, and use herbs and spices instead. Look for low sodium, reduced sodium, light sodium, no added salt, or the American Heart Association logo on the food labels. For packaged foods and frozen meals, avoid foods with more than 500 milligrams of sodium per serving on the label. Drain and rinse canned vegetables under the water before cooking them. Beware of foods high in sodium. Processed meats such as bacon, deli meats, sausages, etc. Condiments such as teriyaki sauce, soy sauce, and barbecue sauce. Pickled and canned foods like pickles, olives, canned soups, and others. And snack foods such as crackers, chips, pretzels, fast foods, and some nuts. Use herbs and spices to add flavor to your food, and avoid spices with the word salt in the name, as well as commercial spice rubs meat tenderizers, bouillon cubes, and others. For example, purchase garlic powder, not garlic salt. Eat more fruits and vegetables and whole grains. Diabetes does not mean that you have to stay away from fruits or grains. Learn how to portion your foods. A heart-healthy diet does not have to be perfect. It is about making good choices within all the different food groups. It is what we do most of the time that matters. You don't have to give up your favorite foods, but you do have to limit how much and how often you eat them. Living heart healthy is good for the whole family. They're your support system. Dieters with more support achieve better results and reach their goals faster. With some minor adjustments, you can reap great benefits in your diet. If you need additional support, please reach out to your health and wellness coach or nutritionist. Mahalo and aloha.